Good morning, everybody. This is Dr. Sonia McGowan. We're getting ready to get started with our monthly webinar. We're just a bit early, so we're going to give people just a couple minutes to get in and join up, and then we're going to get started. So a couple of housekeeping things before we get going. If you have any questions at all, put them over in the Q&A area. I will answer those as they come through, and I'm able to do that at a natural time. You can ask about anything. You can talk about the webinar. We can talk about your kid, whatever you would like to talk about. So, and then I'll also leave some time at the end for additional questions. So expect to be together about 30 minutes, maybe 40 minutes as we go through everything about Pans and Pandas. So welcome, come on in. Let's go ahead and get started here in just a second. Again, if you have any questions, drop those in the Q&A box and I'll answer throughout, and we'll also have some time at the end for questions. All right, here we go. Let's start talking about Pans and Pandas. So I am, again, Dr. Sonia McGowan. Most of you know me. I am the owner of the Covenant Pediatric Wellness Center. And within that practice, we do lots of things. So we primarily focus on the needs of complex kids. So we do functional nutrition, we do neurodevelopmental exams, chiropractic, craniosacral. We do lots of labs to help guide my intervention with these kids. And by complex kids, I mean kids with autism, ADD, ADHD, Pandas, really any sort of struggle that a kid might be having. Maybe they're having trouble being successful in school. Maybe they're having trouble sleeping, difficulty with, poops. Maybe they're a super selective eater. All of that is really what we specialize in. We also have Covenant Pediatrics. So we have Dr. Hannah Strong, who is a general pediatrician. She has experience with complex kids. She has experience with Pandas, as well as just standard everyday people. So the thing that sets us apart, particularly in our city, is she is very respectful of parent wishes in terms of things that other doctors require and will dismiss you if you don't do. So you know what I mean. We also have the Spot for Tots. So this is an arm of our practice that provides comprehensive evaluation and intervention for oral restrictions. So tongue ties, lip ties, cheek ties, all of that. So within that, we do craniosacral therapy, feeding therapy, myofunctional therapy, etc. And then we also have our early beginnings program, which is specific to prenatal and pediatric chiropractic. We have a lactation consultant. We do craniosacral therapy, feeding therapy, etc. So really, kids are our jam for sure. We love to make the tiny mighty. We also serve adults too. So we have chiropractors on staff who will see adults. There are adults who have tongue ties, and so we will happily see complex adults, adults with tongue ties, etc. All right. So what we're going to talk about today, there are lots of acronyms when it comes to PANS Panda. So we're going to kind of walk through what all of those stand for. We're going to talk about symptoms. We're going to talk about triggers. We're going to talk about lab tests and treatments, and basically how we approach Pans and Pandas here at my practice. So in terms of the acronyms, you're going to see lots of different ones, like I mentioned. So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. Pandas is exactly the same thing, but it's associated with strep. Okay, what's happening here? Hold on. I'm going to try to get back to my slides here. Okay. Well, for some reason, our slides want to be funny, and I don't know how to fix that. So be patient with me just 1 second. If I can figure out what to do here. We're going to stop the slide presentation. We're going to start it again and see if that fixes our problem. And it does not. Okay. Well, I'm sorry. I'm not sure. This has never happened before. Don't you love technology? It's great until it's not. Okay. Well, we're just going to do the best we can. I'm not sure how to make this better. There are notes that you can download, and they're notes of the slides, so you will be able to follow along there. So yeah, this is really strange. I'm not sure why the slide suddenly went tiny. So I'm just going to do the best I can. So again, pandas is caused by strep, and so that's where that AS comes from, associated with strep. We also see basal ganglia encephalitis, BGE, and then some people will call it CPIE, or childhood post-infectious encephalitis. All right. So in terms of how does it all fit? So look at PANS like an umbrella. And under the umbrella, we have the potential of two types of triggers. So there can be an infectious trigger, or there can be a metabolic trigger. So if we kind of go on the infectious trigger side, an infectious trigger may be strep. And if that's the pathogen that's causing the symptoms, if we have lab tests and clinical correlation that strep is the issue, then we call it Pandas. If it's an infectious trigger, but it's not strep, so let's say maybe it's a different bacteria, maybe it's Klebsiella or Mycoplasma pneumoniae, maybe it's a virus like Epstein-Barr, HHV6, maybe it's tick-borne, then we call it PANS. Okay, so Pandas is strep, PANS is anything else. If we think about metabolic triggers, so this is some sort of insult to a person's system. That may be things like anesthesia. So it's very common for kids to undergo a procedure that requires anesthesia, and then afterward they regress or have a flare or a new onset of symptoms. So anesthesia, maybe mold, maybe some sort of chemical like pesticide, herbicide. There are all sorts of environmental chemicals that are that our kids are just very susceptible to. And so, again, if it's a metabolic trigger, we call it PANS, no matter what that trigger is. All right, now PANS and Pandas it's a neuroinflammatory autoimmune encephalitis, and so I can't read my own slide. So I'm so sorry. I hope you guys are able to see the slides, because, yeah. So I'm going to pull up my original slide so that I can actually see what I'm talking about. So thank you for being patient with me while I get this figured out. Technology is great. I just love it. Okay, so a diagnostic workup or a referral for that should be considered in any child with a new onset of symptoms or in kids with multiple current diagnoses. So if this is a child who has a long laundry list of various diagnoses, then we need to consider a workup for Pandas. Lacey's asking, is there any correlation aside from the anesthesia with tonsillectomy or adenoidectomy? That's a really good question. So as a general rule, I am in favor of not taking out organs, right? I think we tend to be kind of quick to do that. And so my one exception is with kids with Pandas. A lot of times we see that kids will get better after they've had tonsils out or adenoids out. And so we have to balance the potential of the good that tonsillectomy or adenoidectomy might do for them with the potential of the anesthesia issues. Honestly, I've never really seen anything negative. I've never seen a kid be worse after a tonsillectomy. Now, I've not seen all kids, But just in my experience, kids tend to do better after having their tonsils out. Okay, now let's move on and talk about symptoms. So, symptoms of PANS and PANDAS. There has to be, according to the literature, an abrupt onset. So there has to be an acute change in a child. Now, I'll give you the caveat here. Sometimes kids are so good at just powering through and compensating that we don't always see sort of a night and day difference. But when we look in hindsight, a lot of parents are able to say, I didn't notice it at the time, but now I remember suddenly they started doing this, or over the course of several days, I noticed, an abrupt change. So an abrupt onset of obsessive thoughts and or compulsive behaviors. So these may include, this is what I see really commonly in practice. I see hoarding. So kids will, for some reason, a big one is things like cardboard and paper. Kids will stuff it under their beds. It's in their closets, it's in their dresser drawers. Some kids will hoard trash. I've had kids in the past who could not throw away food that they did not eat. They could not flush the toilet after they used the restroom. So hoarding is a really big one. Also, things that you normally think about compulsive behavior, checking, symmetry, counting. But we also see issues around apologizing or confessing. We will see a lot of religious compulsions or intrusive thoughts around religion. We'll also see fears of contamination or germs, worried about being poisoned, and then rituals around lights, lights on and off, lights only at a certain level, only in certain rooms, or rituals around bedtime. I've got kids who, they have to touch their bed in a certain way. They have to make sure all their stuffed animals are just so. And, some of that's kind of normal, but what we're looking at is, it's intrusive to life. It's an acute onset of that. We'll see sort of compulsive hand washing, maybe aggression or self-injury, and ritualized eating behavior as well. And so we will also often see an abrupt onset of restrictive eating. So this happens in about 20% of cases. Often we'll see weight loss, we'll see dehydration, and the root of this seems to be around some phobias. So these are kids who are afraid that they might choke. They're afraid that they might throw up. They're afraid that their food is poisoned or that it's contaminated in some way. Sometimes the restrictive eating is due to a sensitivity of taste, smell, texture, things like that. One of the other things we're going to talk about in terms of symptoms is kids will have sort of this amplification of sensory sensation. So things are louder, things taste, more intense to them, sounds bother them. And so sometimes it's a sensory issue. It's occasionally related to body image or weight concerns, according to the literature. I've not seen that in kids. I generally have only seen the issues around sensory issues and phobias. We also see anxiety. That could be social anxiety. It could be separation anxiety from parents beyond an age that is appropriate. We have a patient now who is not really able to socialize with friends. They can't even tolerate a friend coming over. They're not able to go into social situations at all. And it's been this way for months and months. We also see emotional lability. So they're up and down. They change on a dime. They're happy and then they're angry. We see a lot of irritability, aggression, defiance. And remember, this is new behavior. We'll also see behavioral regression. So kids will start using baby talk. They'll lose social or play skills. They aren't able to sleep alone anymore. And so we definitely will see changes in their behavior. All right. So academic regression is another trait of Pandas. So frequently we will see a loss of handwriting skills and a loss of math skills. We will also see an onset of what looks like ADD or ADHD type symptoms. So they flit here and there. They can't sit down and pay attention. They can't focus. Well, it isn't that they can't pay attention. It's that they can't filter their attention, right? So everything gets their attention instead of just the one thing that they need to be doing. And then we generally will see a loss of executive functioning skills. So, they lose their ability to plan, to prioritize, to sort of gauge time, things like that. We'll also see irrational fears. So, we had a kid one time who had a fear of the fringe on his cutoff shorts, right? So, or again, the fear of being poisoned, or a new onset of, being fearful of their household pets. Vocal or motor tics are also a big one. And these are important because I have found that the tic often points to where the pathogen is. So we will frequently see kids who will sort of sniff or snort with their nose. Maybe they clear their throat a lot. They have a coughing sort of a tic. And when I see that in kids, I'm immediately thinking, let's culture the throat, let's culture the nose, the sinuses, because often we'll find the pathogen there. So sometimes it's a motor tic, it's a shrug or a turn of the head. Sometimes it's the kids will crinkle their noses, things like that. And then again, the sensory amplification that we talked about. We often frequently see a change in urine habits as well. So that might look like bedwetting. It might be urine or poo accidents in kids who are already potty trained. And then just a change in those habits in terms of more frequency, more volume, or urinary urgency as well. Sleep disturbances are really common. So, a lot of times what we'll see is kids start developing some anxiety as they should be getting ready to go to bed. Sometimes kids are afraid to go upstairs to their bedroom alone. They have trouble going to sleep, staying asleep. A lot of times we'll have what we call parasomnias. So kids who have nightmares or night terrors, or they talk in their sleep, they walk in their sleep. So definite sleep disturbances are common. Sometimes we'll see changes in gait or other physical changes. So it's really common for us to see differences in a kid's deep tendon reflexes. Sometimes we'll see that their pupils don't respond to light as appropriately as they should. Sometimes the way that they walk changes, they become clumsy. And then part of PANS and PANDAS, inherent in this, is a relapsing and a remitting course. And what I mean by that is that the kids will have flares. So they'll do fine, and then they will regress again. And that's very, very difficult for parents to manage, because it's very sort of PTSD invoking when you think you got your kids stable and then all of a sudden they fall apart again. So here are some examples of changes in handwriting. So on the left side of the screen, this comes from the Pandas network. We see on the far left here normal handwriting for this child, and then handwriting during a flare. And the next two are samples from a patient of mine, Grayson. And so on the far right here, you can see how perfect his handwriting is. And then here just to the left, you can see that his actual penmanship is still quite good. But his compulsion is to write as many verbs as he can think of. And so he compulsively writes on words and words on top of each other. And this is what happens to Grayson when he's in a PANDAS flare. All right. So PANS and PANDAS is a very commonly missed diagnosis. About half of kids with PANS will be misdiagnosed and mistreated for over a year. And a year is a really long time in the life of a kid. So it's frustrating for parents because it's difficult to find a practitioner who is experienced, who knows what tests to do, who knows how to interpret those tests, and then knows what to do about it. It's also really common for parents to be told, let's just wait and see. I'm not a fan of the wait and see, because the longer Pans and Pandas goes on without intervention, the harder it is to be successful with that intervention. So 65% of new strep infections caused no symptoms, but were immunologically significant. So in cases like this, what I mean is we have a subclinical infection. So these are kids who do not have symptoms. They don't get a sore throat. They don't have a fever. They don't have a rash. They don't have a bellyache. So there's no indication to mom and dad that they need to go and seek treatment. And so what happens is kid gets strep. We don't know about it. That bacteria cooks and cooks. And then here we move along with now potential autoimmunity, neuroinflammation. All right. Most of the time, these kids are misdiagnosed as having a psychiatric illness. And sometimes you can understand that, right? Because some of the kids we've worked with, they can definitely look psychiatric. We just can't take that at face value. In my opinion, what I say all the time is kids don't go crazy overnight. And so if we have this acute onset of what looks psychiatric, doctors need to understand to look a little bit deeper, and they need to understand what to look for. It's also very frequently misdiagnosed as a tic disorder, including Tourette syndrome. Maybe it's misdiagnosed as OCD, behavioral problems. Really commonly, parents are accused of just being poor parents, which of course is nonsense. So what causes Pandas? Both PANS and Pandas are clinical diagnoses, meaning we look at a combination of history, physical exam, and labs. And so about 81% of the time, the cause of this is strep. So what we're seeing now, sort of retrospectively, is the many, many patients who were diagnosed with a tic disorder, with OCD, some sort of psychiatric illness, are more likely than controls to have had strep 3 months prior. And of course, the more strep you have, the more likely you are to develop Pandas. All right. So cases with multiple prior strep infections have more relapses. So if it seems like, the higher that strep antibody level is, the more likely they're going to have that relapsing and remitting course. And then, of course, like I mentioned, patients frequently have a recent strep infection that doesn't present with a sore throat. So I often will ask parents, has your kid ever had strep? And they say, nope, never, not that we know of, never had strep. And then when we do the labs, we'll find that the strep antibodies are through the roof. Other things that will cause PANS. So we have mycoplasma. That is the second most common cause of PANS. Strep is number 1, mycoplasma is number 2. And then viruses. So generally what I see in practice, Epstein-Barr is number 1 if it's a viral cause. HHV6, HSV1-2, influenza, Coxsackie are all really common viruses, as are cytomegalovirus, parvovirus, and COVID. Mycotoxins are pretty common. We see these are mold toxins. And so our kids just tend to be sponges for any sort of toxin, whether it's mold, whether it's pesticides, plastics, but mycotoxins are a big one. Intestinal yeast, intestinal parasites, Lyme, all can be triggers for PANS. And then when we talk about the relapsing remitting course, so, kids get better and then they get worse, and they get better and they get worse. There are things that can trigger those kinds of flares. Generally, it's exposure to a pathogen. So anything that stresses the immune system can definitely cause kids to have a relapse. Maybe it's strep, maybe it's a virus, maybe it's a different virus than what originally caused their PANS. Allergies and sinusitis are big. So we see a lot of kids who will relapse with symptoms during spring and fall when allergies are so bad. The other thing that will cause a flare is vaccination, because of course that creates quite a burden to the immune system. And then metabolic stressors, we've kind of talked about these a little bit. Trauma, anesthesia, stress, mold exposure, pesticides, etc. Anything dental is also a major trigger for these kids. So a loose tooth, a new tooth that's coming in, getting braces, getting a palate expander, getting a vigorous cleaning, anything that disrupts the gum line in the mouth can release a lot of bacteria, particularly strep, and cause a flare for our kids. All right, so what makes kids vulnerable? It's really important for us to know this in order for our long-term intervention to be successful. Pretty much every case I've ever seen, and I've seen hundreds of kids with PANS and PANDAS, they generally have some underlying metabolic inefficiencies. So we will see things like nutrient deficiencies. So B vitamins, fatty acids, vitamin D, we'll see low cholesterol, we'll see low iron. And that tends to feed into what we call mitochondrial dysfunction. So when you can't make energy inside the cell, it's impossible for your body to efficiently do higher level things like have an efficient, stable immune system. And so mitochondrial dysfunction is really, really common in complex kids, and it's exceedingly common in kids with PANS, PANDAS, even those kids who were neurotypical before. And so this creates quite a susceptibility, as does intestinal dysbiosis. So, yeast overgrowing in the intestine, bacteria, and then nervous system dysregulation. So, generally these are kids who are hung up in fight or flight, right? They're not good sleepers. They're not good poopers. They're not great at digesting their food. And so, these are things that we have to address first so that the body can respond appropriately as we use our specific interventions for PANS and PANDAS. All right. So in terms of age of onset and incidence rate, so the literature says 1 in 200 kids has PANS or PANDAS. I think it's more than that. I think we're just getting started in terms of understanding this disorder and, gathering the data on it. The average age of onset is 4 to 13 years old. I have seen onset. So technically, you're supposed to have an onset before puberty. It doesn't always happen that way. Sometimes we had the onset, but parents didn't realize it because it wasn't sort of a night or day change for them. Generally, once we get past puberty, symptoms really start looking better and more manageable. And you can have PANS and PANDAS without an autism diagnosis. There are a lot of people who think they go together. Sometimes they do co-occur, but we see lots and lots of kids who were previously considered neurotypical and then had a new onset of symptoms with a diagnosis of PANS or PANDAS. All right, so how do we figure this out? So we have to do a thorough history. We have to do all the due diligence to look at family history, prior medical history, because it's very common for a child to have a parent with an autoimmune condition. So RA, Crohn's, lupus, something like that. So about 64% of kids with PANS and PANDAS have a first-degree relative with an autoimmune diagnosis. We also have to do a very thorough physical exam. Sadly, from what other families tell me, it's rare for a kid to have a really thorough physical diagnosis, but we have to look at things like pupillary response. We have to look at deep tendon reflexes. We have to look at the skin. We have to listen to the heart and the lungs. So it's just very important to have a really good, thorough physical workup. We look very carefully in the nose, in the ears, and in the throat. Again, remember, you can have a strep infection without having a diagnosis of strep throat or without having a sore throat at all. So sometimes we'll do rapid strep testing. Sometimes we'll do a throat culture. Sometimes we'll do a nasal culture or a rectal culture, because strep and these other pathogens can be pretty difficult to nail down. So we want to look and be very thorough. So I run labs. I do general things to begin with. So we will do things like a CBC and a CMP just to get a basic baseline. We'll look at vitamin D, we'll look at lipids, we'll look at iron, ferritin. And then we also do labs that are specific to whatever pathogen seems most likely. So I generally do strep antibodies. I generally do viral antibodies as well. So whatever I think is causing the problem is what I'm going to test for. If I feel like maybe it's a tick-borne origin, or maybe it's anesthesia, right? So we want to just dig in there and figure that out. We will do specific labs to gauge inflammation, to also look at immune system response as well. So it's absolutely critical that we identify and intervene on the correct pathogen in the right order. So it's very common to have a kid's labs come back that say, strep is through the roof, and so is, for example, Epstein-Barr viral antibodies. And what I've discovered clinically is that if strep is present, we always intervene on strep first. And when we do, a lot of times other pathogens will work themselves out. The immune system stabilizes. We're working on what's made the child vulnerable, so we're tackling those deficiencies. We are working on mitochondrial dysfunction. We're getting cholesterol where it needs to be so that the immune system is more stable. We work on strep, and the viral antibodies will often respond in kind without direct intervention. So it's important that we do the right thing at the right time, in the right order. So traditional treatments are specific to what that pathogen is. So if it's strep or another bacteria, it's going to be antibiotics. Sometimes we will use, traditional medical providers will use steroids or other anti-inflammatories. There are some providers who think the tincture of thyme is the right approach. I do not. We don't sit and wait on this. We don't wait and see what's going to happen, because most of the time we're going to get worse. So I do not like to give it time. I think that's nonsense. Other traditional treatments might be something like IVIG or plasmapheresis. Tonsils out, adenoids out sometimes is quite helpful. And then any particular medication that's specific to whatever pathogen or toxin we might be dealing with. So in terms of holistic interventions, we, of course, sort of follow that same treatment protocol, but with natural remedies. So natural anti-inflammatories, antihistamines, those will cool the brain off, right? So this is an encephalitis situation. It's a brain on fire. It's high inflammation. It's immune system over responding. So when we can give natural means to calm that system down, then kids will generally stabilize pretty quickly. I often really rely on homeopathy, because for a lot of kids, what's happening, let's say we're dealing with Epstein-Barr. It's normal for us to be exposed to a virus like Epstein-Barr. What generally happens is we're exposed, our immune systems respond, and the virus is managed. With kids with Pandas, what happens is that immune system will upregulate like it should, but the problem is it doesn't have the stability to downregulate when that fight is over. And so it's like, your foot's on the gas constantly, creating a lot of, unnecessary energy. And so when we use homeopathy, it's very effective at helping us downregulate that immune response and stabilize the immune system. I really, really like homeopathy because it's super effective, but it's gentle. We don't want, kids to feel worse because of our intervention. And I like that different forms are available. So it makes it easy for kids who can't swallow pills. So, I mean, we can do pills, but we can also do pellets that melt away. There are liquids. There are rectal suppositories as well. So we have some nice various options when it comes to homeopathy. Sometimes I use herbs. I really use a lot of herbs, antibacterial, antiviral herbs, when the mouth is a trigger. So when kids start to get wiggly teeth and then their behavior sort of flares, we can use some herbal toothpastes and mouthwashes and mouth sprays that will help keep that under control. All right, so we have to, again, address what made them vulnerable. So address nutrient deficiencies, mitochondrial dysfunction, heal up their intestine, stabilize the immune system, stabilize their nervous system response. The very best way, in my opinion, to do that is with chiropractic adjustments by a pediatric chiropractor. Craniosacral therapy is also very good. And when we do those things together, we really see kids respond quickly. And so when we intervene, what do we expect? So generally, I see kids will improve pretty quickly. But we have to remember, it took them a while to get here. It's going to take them a while to get better. And so sometimes it takes a bit to calm that inflammation and start seeing some improvements. But of course, the earlier we intervene, the better the response. And you have to also remember that flares are probable. It's a part of the diagnosis. The criteria is a relapsing and remitting course. So we're going to see kids get better and then flare up and get worse. And so, what we try to do very intentionally is to prepare families for the fact that it is a relapsing remitting course. So let's put some tools in your toolbox. So when, kid has a flare at 11 p.m. on a Saturday night, you've got some tools to work with. And so, like I mentioned before, sometimes families really struggle to find a practitioner to help them. There are doctors who will just flat out say Pandas is not a real thing. If they can find a provider who is willing to help them, that practitioner they're just not experienced. And to be fair, Pandas is sort of fairly new to the landscape. And so it's not yet widely taught. It's not yet widely understood. And so it's just really a struggle for families to find help for their child. And so whether you're watching as a practitioner or as a parent, it's important for you to understand that when kids come with a long list of diagnoses, this should be a red flag, and a Pandas workup should definitely be considered. So if you want more information about Pandas and PANS, there are a couple of really good, reliable sources. The Pandas Network is excellent. The Pandas Physician Network is also really good. They have very good resources, but they also have a directory of doctors who are experienced and trained with PANS and Pandas. And so if you need more information about Covenant and what we do, here is our contact information. You can call us anytime. My email address is right there, drsonia@covenantwellness.net. So if you have any questions at all, if you feel like you want to schedule an appointment, if you're a practitioner and you want to come hang out with us for a day and see what we do, we're also open to that as well. So I hope that was helpful. Again, my apologies for the technology. If you're having trouble accessing the slides, the note pages from this platform, just email me and I'd be happy to send you a PDF form of that via email. So again, thanks for attending. Our next one, I generally do these on the first Friday of each month, but because of the 4th of July holiday coming up, I have moved the next one. So instead of being early July, it's actually Friday, July 28th at 9 a.m. We're going to be talking about oral restrictions. So talking about lip ties, tongue ties, cheek ties, how that affects development, how to identify it, what to do about it, etc. So you will definitely not want to miss that. It'll be a good one. All right. I'll leave you just a minute here to throw in any questions that you might have before I let you go. Any questions at all? All right. Very good. Well, remember my email address, drsonia@covenantwellness.net, if you need anything at all. And hopefully we will see you at our next webinar on June 28th at 9 a.m. All right, guys. Have a great day.